This is WPSL Port St. Lucie, the talk of the Treasure Coast.
And good morning. It is 11:07 at WPSL, Talk of the Treasure Coast, and welcome to Never Alone by Harbor Place. It's independent living and assisted living here in Port St. Lucie. And welcome to the Executive Director, Kandi Tucker.
Good morning. How are you doing?
I'm fine. How are you?
I'm great. Thank you. Today we have a special guest. His name is Ron Radcliffe. He is with Senior Helpers.
Good morning. How are you?
Good. How are you?
I'm doing well. Thank you so much for having me on the show.
So can you tell us about what your role is with Senior Helpers?
Absolutely, yes. My role with the company is as an owner and the chief operating officer. And for those not familiar with Senior Helpers, we are a private duty home care company serving Martin, St. Lucie, and Indian River counties. And that term private duty home care sometimes can be confusing for seniors if they've not had to navigate the senior care continuum in the past. And simply put, what we do is we go into the private homes of seniors, or really any adult who requires some added assistance or has some needs to make sure that they can remain safely in their current living environment and be successful in that environment. So, that takes on many different shapes and forms. On the lighter end of the spectrum, it may just be going in, for a couple hours a week and, doing some light housekeeping, meal preparation, taking people to appointments, to run errands, or just simply spending time with them and providing some socialism, which so many seniors, unfortunately, do not have in their lives. They're kind of tied to their home without much interaction. But a large segment of our population and clients that we serve also need a higher level of care, meaning they need assistance with what we call activities of daily living. So things like getting up, getting dressed, help with their personal hygiene, bathing, or even being nearby while they bathe to make sure that they're there safely, going through that process safely, because that's an area that, as we all know, there are a lot of seniors do get injuries when they are in the bathroom, particularly when they're bathing or showering. We also provide dementia-specific care and supervision to make sure that our folks who are suffering neurodegenerative disorders and have short-term memory loss and need some added supervision and assistance are safe in their day-to-day routine. And then also medication management services to talk to the doctors, talk to the pharmacies, make sure that they're compliant with their medications, they're taking them the right way, they're following the parameters that are set up by their physician, which is really one of the most common catalysts to cause somebody to deteriorate and perhaps have hospitalization or require rehab unnecessarily.
Right. How long have you been with Senior Helpers?
Well, I started the office back when we opened here in the Treasure Coast in 2012. So I guess we're going on it'll be 24, or not 24, my math's terrible. It'll go on 12 years this summer that we've been operating up on the Treasure Coast. And honestly, in that period of time, we have just grown to become one of the premier home care agencies in this area. And that comes with a lot of hard work. A lot of commitment to higher standards of care, a lot of commitment to recruiting the right caregivers. And we have over 200 caregivers that work for us, but making sure that we're hiring the best of the best, that they're well trained, that they understand their role, and making sure that they're a good match with the clients who are requiring care.
Well, congratulations on your 12 years.
Thank you.
That is fantastic. So if I was a family member,
Thank you.
Let's just say my father needed help in his home, how do I go about setting that up? What is the process?
So if somebody is looking for care or just wants more information on care, we will send one of our client services managers out to their home. There's no fee for that whatsoever. It's just a chance to have a dialogue, to learn a little bit more about what their condition is. What are they struggling with, if anything? What is the home environment like? We know that the greatest risks for seniors lie with the environment, with the person, or with the tasks that that person needs to have done or is trying to do in that environment. So going in and being able to really troubleshoot that, to identify the risk areas, to set up a comprehensive plan of care that addresses those risk areas, and then to put the care in place if the family wants to proceed. So going through the paperwork process, all of that fun stuff, of course, on the front end. And then we get to work trying to find the caregiver that we have on our team that we feel would be the best match for that client and for that family.
Okay. Now, are the rates, do they differ? Are there any kinds of levels of care that that makes the price different from one person to the next?
That's actually a great question, and one that we commonly are asked. And the short answer is yes. What we do differently than a lot of our competitors is that we have no minimum. Meaning, a lot of other home care companies will require, a minimum of a 4-hour visit or a 6-hour visit, or maybe 32 hours of care within a given week to provide a caregiver to that family. We don't have a minimum. We will go into homes for a half hour once a week if that's what's needed. The price of that visit will be a little more expensive than a longer visit because obviously with our staff, we have to pay them a little bit more to incentivize them to, to take a case that is going to be a little bit shorter in duration. But that being said, for many families, that's just the most cost effective way to receive the service. One of the things that I'm very proud about at Senior Helpers, and I should also share that I am a lifelong resident of this area. I was raised on the Treasure Coast in Martin County. I know the area well. I know it professionally well because I've worked in this profession for in excess of 25 years. I really do feel like we go above and beyond when we identify those needs, not just to promote our own company. Certainly, if there's a way that we can provide care and bring more safety and a higher quality of life and well-being to that person, we feel we do that very well and we want them to consider us. But many times just looking at even cost factors and the family's needs and the family's routine and schedule, what we really become more of is a resource broker, being well oriented, knowledgeable of the different resources that are available in our local community and being able to piece together care options that are going to be more cost effective. So for an example, we may say, well, your loved one does need 12 hours of supervision if you leave in the morning to go work and come home later at night. They really aren't safe to be home alone. There are great risks there. But if home care is not perhaps the cost of home care is too high to do that, let's look at some other options as well, such as an adult day center. Perhaps we come in, get them up and dressed and bring them to the day center. And then on the back end, we pick them up, bring them home, make sure they have dinner, make sure they're showered, get them settled in for the night. And you can stretch your dollars further by using many of the resources available to you in a much more cost-effective way. And honestly, that's usually in the best interest of the client as well, because it's great for them to get out of the home if they're willing to do that and have that social interaction and be in an environment that perhaps is a little more stimulating based on their condition. So being able to tie all those things together and bring those resources to the family, I think really allows us to stand apart.
Well, if I might add too, just looking at your website, you had some options for help, particularly VA benefit care, that people may have some help that they don't even know about.
Mm-hmm. Yes, absolutely true. Yes, we're very proud to be a provider with the Veterans Administration. And what's sad, and I know this is something that gets addressed on this show as well, is there are so many seniors who have served this country that don't even realize that they're eligible for services and for help that won't cost them a dime. So through the Community Care Network, if there's a senior who is a veteran who receives their primary care through the VA system, they are eligible for benefits of up to 21 hours of care in the home, and the bill is paid for by the VA. Now, there are a number of other pension programs and other uh, services that the VA offers, and we don't have enough time to go into all of that in this episode. But being able to bring that to the table for seniors and realize again that they can stretch those dollars further. And these are hard-earned dollars. These folks have sacrificed a lot in their life and in their service to their country. Use it to your benefit, use it to your own well-being. In addition to being a VA provider, we also contract and work closely with long-term care companies. So there are a lot of folks out there actually who have long-term care insurance. Some because they had the vision to purchase it earlier in their life, some because it was a benefit offered in their employment somewhere along the line. And that can really make a profound difference in somebody's ability to afford care in the home versus perhaps, moving to, another care setting earlier than they would normally have done so. So long-term care is another payment option. We also contract with a number of human service organizations and other governmental entities where there's trickle-down dollars that help pay for personal care in the home. So again, having that free assessment, that chance to talk to our staff and really explore the situation and what options are available to that family is paramount. And they don't have to use us. Like I say to many families, just having the conversation with us, learning more about the organization, even completing the paperwork so that, God forbid, if there is an emergency, say perhaps the well caregiver falls down and breaks a hip in Publix and is transported to the hospital, and they're the primary caregiver for their loved one, we're ready to kick into action to get somebody to that house to make sure that they're looked after and their needs are being met. Well, another plan is worked out, or while that person goes through their own, recovery process. So, being a little more offensive with the way we use our resources rather than waiting till something tragic or something concerning has happened.
Now, do you have any nurses with you, or do you have any nurses that are employed with senior helpers?
We do. We have, like I said, we have well over 200 staff members. The majority are home health aides and certified nursing assistants, because quite honestly, that is the vast majority of the kind of work that we do. But we are a licensed home health care provider, and we can provide skilled care. Again, that may not be a term that a lot of listeners are familiar with if they haven't gone through the process of navigating the healthcare continuum. But skilled care means that a nurse can provide some skilled services due to their professional licensure. So again, medication management. If we needed to do some wound care, we could do wound care as well. What we do not offer, because there's plenty of other companies that do this, we do not offer the skilled care that involves physical therapy, occupational therapy, speech therapy, respiratory therapy. A lot of those are already covered through the Medicare system. It is a different branch of home health care that's a little bit different than private duty with what we do, but we work very symbiotically with those providers. We often share referrals back and forth because they're coming in for a finite period of time to address some very specific clinical needs and rehabilitation, while our staff is more so there for the ongoing care and support that person is going to need, even after their Medicare home health care company may stop visiting.
Okay. So what is the protocol if you have a resident? I call them residents. I don't know if you call them patients or clients, but if you have a resident,
we use the term clients. Yeah, we use the term clients. And I know each, having worked in different domains of the healthcare setting, usually there's a different term each faction uses, but we use clients.
And, with most home health companies, the goal is to keep them home for as long as possible. So what is the protocol when you have a resident in their home and they're declining? Is there any kind of paperwork that is done? Does the nurse go out and reassess and make a recommendation to an assisted living or a skilled nursing?
Absolutely. So, I mean, I think we all could agree that if we ourselves were aging and we're suffering from some chronic, debilitating, progressive disease, which many folks are, we feel most comfortable in our home, and we're likely to flourish in our home if we can get the care provided in that setting. But that's not to say that that's the best place for everybody to be either. I mean, that requires a very immense safety net of support services and resources to be able to do that well. And let's be honest, some families just simply either don't have that. Perhaps there's not family members that live locally that can provide that added assistance. Perhaps there's, financial challenges that prevent them from doing that as well. And, there are many times that the best option for that person, or they've reached a point and the progression of their condition that they really need the added level of care and support and supervision that comes with a residential setting. So to answer your question, Kandi, yes, we do ongoing assessments and reassessments for the life of the client with our company. Typically that is every 90 days. We are going back out and doing a reassessment, but if it needs to be more frequently, it's more frequently as their needs change. So we have at-risk meetings twice a week with our staff team in the office to go through and discuss each client and what they're struggling with, and kind of make that determination. Is it time to start looking for other resources with this family, and perhaps reach out to senior living, whether it's assisted living, maybe memory care? Is it a skilled nursing facility needed? Again, that comes with being that resource broker. So we are absolutely in a position where we make those referrals on a daily basis. Yes. In addition to that, there are a lot of clients that we serve that are already living in residential communities, whether it's independent living, assisted living, or memory care, or skilled nursing. Because many times people still need that added one-on-one support. If they're at risk for falls, even in an assisted living setting, they may still need somebody by their side. Because in assisted living, there's not one-on-one. It's not designed or licensed to be a one-on-one care provider. So many families will call us in for that purpose, or perhaps their loved one went to the hospital, went to rehab, and are returning back to their living environment, and they just want some added support to make sure they get settled in well, keep some eyes on them on a one-on-one basis, and then gradually taper off if things are going well.
Yes, and I've seen a lot of that here at Harbor Place. I have residents that are in our independent living building. They have some companions just to sit with them and, just to talk. I have some residents that will have a home health aide to come and do laundry, or come and take them to church on Sunday, or come in, have dinner with them. There's a variety of different things that are being provided for these residents to keep them in their home, and especially in independent living, when they're not ready to make that transition over to assisted living. And with the help of a companion or a home health aide, they are able to stay in their apartment for much longer.
Right, absolutely. Yeah, and we're a critical component of allowing people to do that. And and it's not always a lot of care that's needed. Believe it or not, sometimes it's just, can you help me get the fitted sheet on my bed? Or help me clean out my upper cabinets, or things that we maybe take for granted in our day-to-day life. But as we age and our body becomes a little more functionally limited, it is a little bit tougher to do, and it is sometimes activities that really do create vulnerability to injury. And our goal is to keep them safe, keep them in their well-being intact, so that they can flourish in that independent living setting for as long as possible.
Right. Yeah. And we're always so grateful that we have several different home health. I've been in this industry for over 20 years now. And it is always such a relief I remember when I worked as an aide, over 20 years ago on the floor, and I would have a resident that had a companion or, a personal caregiver. And it was always such a treat. It allowed me to give extra care to some of my other residents, just for that one resident to have a personal care companion or aide to assist them. So, so with you being with Senior Helpers for the years that you've been, and how do you maintain your clients? How do you maintain where do you get your referrals from? I mean, do they just call daily? If I Google, home health, will
Mhm.
senior helpers just pop up? How can people, know who you are?
Yeah, that's a great question. So, we first of all, we get referrals from many, many different areas, be they from Medicare, home health, adult day centers, people that we met at health fairs. We do a lot of it. I personally do a lot of educational seminars and presentations throughout the community, and certainly people who are surfing the web. So, I do want to take the opportunity to share our web address. And honestly, the easiest way to find us is to go to seniorhelpers.com, which is our national website. But once you're on that page, you can actually put in your zip code or the city in which you reside, and it will pull up the local office for you. And it's a great page where you can see what we're doing on the local level. You can see our pictures, our bios, meet our staff, our phone number, all of that is accessible. Our phone number, for those that may be listening, is, of course, area code 772-463-1112. Again, 772-463-1112, or they can reach us on the internet at seniorhelpers.com.
Great. So when you speak about educational seminars, what are you speaking about with those? What are the topics?
So many different topics. Some of the more popular ones are navigating the healthcare continuum, educating seniors of all the services that are really available within our local community. Again, as I said earlier, if you haven't had to navigate the healthcare continuum, particularly with the senior focus, it can be, and this, Kitty, from working in the industry, it can be such an overwhelming, daunting task because there are so many different types of providers out there, knowing who does what and what does insurance cover, what's Medicare versus what's Medicaid versus what's private insurance, what's long-term care insurance, what's adult daycare, what's assisted living, what's memory care, what's hospice. There's so
Yeah.
many things out there in the continuum. So going through and kind of going through kind of from one end of the spectrum to the other and educating people on what they are and how to use them, and the benefit of looking at all of those things now and vetting a lot of those providers now on the front end, so that if by chance you have to go through this process, or as you or your loved one may have some deterioration in their condition, you already know who you would want to be your provider, rather than trying to scurry to make a decision at the last minute when we don't typically do our best, right, in terms of making those choices. Another area that I'm personally very passionate about, and I do a lot of education and training on, is the dementia-related disorders, the neurodegenerative disorders, right? So we know in our population that one and every 6 people that we serve is going to have some sort of neurodegenerative condition, whether it's Alzheimer's disease or vascular dementia, Lewy bodies, frontal temporal lobe, Parkinson's related dementia. And senior helpers, one of the differentiators in our organization, and really the thing that brought me to the senior helpers family, was their commitment to dementia specific care. So about 12 years ago, around the time I got involved with the company, we partnered nationally with a woman by the name of Teepa Snow. And if your listeners don't know of her, I encourage them to Google her. Her first name is Teepa, Teepa Snow, Snow. And she has become a world-renowned dementia care practitioner, specialist, and literally travels the world speaking. She's got about a 2.5 year waiting list. We have the ability to bring her down every year. We just had her actually come speak in Jupiter. We had over 400 attendees.
Wow.
Um, and she did another phenomenal presentation for families, a 3-hour presentation in the morning and a 3-hour presentation in the afternoon. And we have curriculum that we utilize and train staff on, specific to understanding those neurodegenerative disorders in a much better way. Unfortunately, there's not a lot of training on that in our industry when there really should be, given the incidence and how many people are affected by it. So to be able to go in and provide that training to understand how do these disorders affect the brain, because they are brain diseases, and what do we need to understand and recognize is changing in that person's brain, But what oftentimes is overlooked is what in the brain is still working well. What parts of the brain, what lobes are still working well? And how do we utilize that in our approach to provide care and interventions? How do we incorporate that when we try to communicate with somebody or try to get them to engage in a task? How do we look through their lens, which I say, listen, it's one thing to see something from someone's perspective. It's another thing to feel it from their perspective. That's the empathy approach, right? So
Right.
how do we allow our family members and our staff that provide care to feel it from their perspective and adapt the way we present, the way we intervene to get better outcomes? So our Senior Gems program is actually based on TIPA's curriculum and is really the crux of that philosophy and that mentality of care. We also facilitate virtual dementia tours. So I'm a certified facilitator in that as well. And it allows family members the opportunity to go through the experience. And I underscore the word experience. It's not a training, it's not a teaching mechanism. It's really an experience that what I have found gives so many people kind of this epiphany of, oh my gosh, I never realized that that's the way it could feel like if I were to have dementia. And to be able to do that, we actually have to really wreak havoc on their sensory experience. We have to overload their sensory experience auditorily, visually, tactily, so that we put them in a situation where they know there are tasks and things that need to be done, but they're not quite sure what they are, and it's very hard to navigate it. And what's so interesting about this experience is that every behavior we see that person engage in, or even perhaps struggle with in that setting, directly parallels to behaviors we see in people that have dementia. So it's a great opportunity to connect with those feelings, and for the well caregiver, for the family member, for the staff that go through it, to look at that person that they're caring for and say, gosh, I recognize this behavior. I remember how it felt like when I was feeling these things. Maybe this is what I need to change or adapt in my approach to be more sensitive to what they're going through
Right.
and to get a better outcome in whatever it is we're trying to achieve.
Now, how do they sign up for this experience?
So we do these frequently throughout the year, and we actually have a distribution list that we email out to. That's probably close to 600-700 people wide now. And whenever we schedule one, we make sure we email that out to everybody. We put it on our Facebook page, our LinkedIn page. We promote it throughout the network. That's how, that list has literally grown, Kandi, year after year, from people that have come to our Senior Gems training, the virtual dementia tour, the navigating the continuum care, all of the offerings that we've done over the years, the TIPA snow events. So it's something that we do frequently. I'd say probably 3-4 times a year. The Senior Gems, we usually do 3 or 4 times a year in different environments. If there are any senior living communities, especially with the virtual dementia tour, that are interested in hosting that, it's a great opportunity because we can use one of the vacant apartments to kind of have a more realistic setting for that exercise. But it's also a chance for people to go in and see what that senior living community is all about. Sometimes we operate with these stereotypes of what we think they are, but once we're there, we realize it's nothing like that. So get people in the building is also very beneficial for the family as well.
So when is the next TIPA Snow? When is the next meeting or talk with her?
Yeah, so for TIPA herself, we're actually in communications with her staff, her team right now. Like I said, I think it was January 31st is when we had her for the day. And it was the biggest event we did with her yet. I mean, we had 15 vendors. We actually have hosted it the last few years at a phenomenal church, Jupiter First Church, that we chose because it's central. But this is just a quick shout out to that church. They've just always been so generous. They can seat over 900 people. They never charge us. Quite the opposite. They provide volunteers to help us with coordination of the event, to be there the day of the event, to help make sure people get to where they're going.
Right.
Easily. And they were just as excited after this last one. They said, let's do it even bigger next year. Let's try to get 500 people here. Let's try to get, double the vendors. So we have not landed on a date yet. I've got to work with, literally she's traveling, and she's over in Australia now, and then she's going to Malaysia, and she travels the world doing this. So it's trying to find the right date and time in her schedule to get her back down. So once we have that set, certainly we'll have saved the date, emails, flyers, be distributed throughout the network.
And how does one become a vendor during that event?
So when we put out the flyer with a save the date, we typically let folks know that there are vendor opportunities as well. And they just get in touch. Generally, I'm the one that coordinates it and organizes the event. So they get in touch with me, and we go from there.
That sounds good. So I know you have a lot of caregivers. Is there any kind of support groups for your caregivers and HHAs?
That's a wonderful question. And through our organization, I think there's not a formal support group we have for caregivers. Are you talking about family caregivers or professional caregivers?
Both.
Okay, both. So for family caregivers, while we do not offer our own support group for them, because there are so many support groups in the community already that exist, what we do is we will share with them information about the support group options. For professional caregivers, because listen, they need support too sometimes, right?
Yes.
I mean, you know this from your background and being an assistant, right? That listen, while we're professionals, we still also get emotionally attached to the people we serve, right? It's just, we're humans, right? That's what drew us to this profession. When we see somebody that we've invested a lot of time, even if it's professional caregiving, we are attached to them. We are attached to the family. And when we see them, deteriorate over time, and certainly when they pass, that does leave us with a bit of a void in our soul too. So in our office, and being a smaller office too, a lot of that support kind of comes through the day-to-day interaction, conversation, dialogue that we have with the caregiver when we're discussing their client and the family dynamics. There are, I believe, some support groups that are available for professionals, but the challenge for professionals too is that they're so busy working. So many of them also busy with their families that, it's not always convenient for them to go to a physical group setting for that. And in our business, because they are working in independent homes, we literally, our staff is deployed at any hour of any day at any time. We do overnight shifts, we do day shifts, we do transportation, we do 1 hour, we do 12-hour, and all different schedules, weekends, days, nights, holidays. So that's a little more challenging for us, but it is very important, especially for family caregivers. One of the things I do want to share, if I may, as we talk about things that make us a little bit different, and that I'm really proud of our organization, is we are the only private duty home care company that I'm aware of to actually utilize an assessment that is studied, researched, published empirically in terms of efficacy in keeping people safe and in their home and lowering their risks. So we call it our life profile. It actually is born of a assessment tool that was researched in for over 20 years with over 75,000 root cause analyses, right? So what that means is, 75,000 studies of what caused a senior to go to a hospital and then to rehab and go through that continuum, that process that so many are familiar with. But what prompted that to begin with? And why this is so insightful to me is that in our healthcare industry, we are so disjointed, right? We are kind of all in our silos of what we do. And while we try to learn about the other, domains of the continuum, and we make those referrals and all those things, at the end of the day, we are generally kind of focused on what we do in our own respective silo. And it's kind of insanity when you think about it. So for instance, I always think of this one case study of a woman who walks up a few steps to her department. She's got a walker, right? She's independent with walker, and she's got a bag from the store, and she's using her walker. She goes up 2 steps to her front door, and she kind of puts her walker to the side and opens the store, like the little screen door, and then blocks it with her walker to try to open the front door. And one day she loses a little balance and she falls off the step and into the bushes, and she breaks a hip, right? So what happened? She goes to the hospital. She has a hip replacement. She goes to rehab, she gets PTOT, then she goes home. Well, guess what's not been addressed in that home? That same stoop, those same doors that made her go there in the first place, right? And more so than not, that's kind of the la la land that we live in. It's like we're not all connecting and pulling that all together to say, oh my gosh, what caused this to happen in the first place? So that's was kind of the catalyst and one of the root cause analyses that led to this development of this assessment tool. And we purchased this assessment tool. It's proprietary to us. And we go into the home as part of our assessment process and we utilize this tool. And what it allows us to do is we gauge 144 different safety risks within the environment. We look at 7 key areas, which really indicate to us whether the person is able to manage their medical condition and understands their medical condition and what needs to be managed. A lot of this is medication related, compliance issues. We look at the burden of care if there's other family members in the home. We certainly look at quality of life. And we're able to come up with what we call an autonomy score, which pulls all of this together in an algorithm to encapsulate what their score is, their risk score essentially. And with that score, we can sit down at the end of that assessment and on a tablet show them on a metered system based on 20 years of research and 75,000 studies. And we're talking big institutions here, well-known institutions throughout the country. Your risk of being hospitalized or going to a rehabilitation center in the next 6 months is 85%. That's all tied to empirical data. But if we make these 3 changes, just these 3, because Rome is not built in a day, we can automatically move that needle and lower that to, say, 45%, right? And then we continue working on those things to get it down further and further. But the great thing, and the thing I love about it, Kandi, is it's not just us. Yeah, we have a role to play if they choose to use us. Maybe they don't choose to use us. But there's also things we can identify that the family can do. Things like, okay, maybe we put this bathroom door on a swing hinge or remove it altogether so you're not trying to go through the bathroom door with your walker sideways because it doesn't fit through head on. Or move your wheels to the inside so there's better stability. Or make sure you're using a transfer bench in the shower rather than that plastic patio chair you have sitting in your shower stall. That is flimsy and a huge risk, you know? So going through these things that sometimes for family members and even professionals in the field, we kind of glaze past, really have a powerful impact on lowering their risk. So there's things that families can do. And there's a lot of things that other third-party providers and resources in the community can do, whether it's geriatric care management or durable medical equipment or estate planning or, lawn mowing or Medicare home health or Part B therapy for strength training, whatever it may be. We can pull all of these things together to create a plan of care for the family that's a lot more eclectic and comprehensive, therefore much more effective in keeping them safe in that home setting for a longer period of time. And then that is our life profile. It's better assessments lead to better care plans, lead to better outcomes. And that's what we're all after.
That is amazing. That's truly amazing. I want to go back. We were speaking about caregiver support. We do offer that here at Harbor Place. Treasure Coast Hospice, they host it for us once a month at 10:30. They do it for caregivers and professional caregivers as well.
Oh, great. Oh, that's great. Okay.
It's no cost. I'll send you an email about it. And that way you can, let your staff know if they ever need any kind of support, that they speak freely. They, what happens in there, pretty much everyone's welcome. And because caregivers, a lot of the times they work so much and so hard. And at times you can get frustrated.
Oh, yeah.
So, that is a safe space for them to speak out and get some of the necessary tools that they need to keep going with their daily lives.
That's phenomenal. And I commend Harbor Place and Treasure Coast Hospice for collaborating and bringing that to professional caregivers who are, as we said before, often overlooked. And, it's a labor of love, and it is not an easy job. Any family caregiver will tell you it's not an easy job too. And it's unfortunately, given sometimes the maybe misaligned priorities of our society, not one that is the most rewarding job from a financial perspective. I mean, when you look at the impact that they have on people's lives. So that's a very special thing you offer. Thank you for doing what you do.
Oh, thank you. For me, I have my grandfather had Parkinson's and Alzheimer's dementia, so I knew about that at an early age. Uh, and my first community that I had 20 years ago, it was a small 20-bed Alzheimer and dementia community, and I had never seen anything like it before in my life, and those residents, that was my first time being around seniors that suffered with the dementia uh, all at the same time. And it was an eye opener for me. And all I wanted to do was to help in some kind of way. Um, I can still remember all of those residents' names. Those residents really helped shape me to who I am today. I am always going to remember that community that I had in Charlotte, North Carolina.
Uh, that's one, that's, well, thank you for sharing that, number one. And that's those are the things we as professionals, and you and your community, and certainly me with our company as well. That's the motivation, right? That's the kind of people that you want to have working for you, that are led there by passion. You can teach skills. We can learn skills, but that level of passion is really what makes all of the difference. And listen, if you're caring for people, particularly those with dementia, it is hard, and you encounter some very intimidating experiences through that process. So the training and the support and anything that we can bring to the table to make that easier for caregivers, professional or family caregivers,
Right.
is really critical.
Yeah. It is something that will stay with me for the rest of my life. I mean, I can still remember their names. And
Yeah.
again, I had a resident. She prayed for everyone every day. I had colonels. They were outstanding. Their children were outstanding. I had residents that would speak in a certain language that was English, but it wasn't, you couldn't comprehend. But it got to the point where I knew exactly what they meant. I knew that Mary wanted some milk, or
Yeah.
she needed to go to the restroom.
Yeah.
She didn't like her sandwich. She wanted some chicken, and for me, I've pretty much worked in every single department before I got to where I am today. And ultimately, I have the ability to teach those who may not understand what bedside manners are.
Mm-hmm.
I do. So I have the ability to teach them, and being with these seniors every day. And I'm still new here at Harbor Place, so I'm still getting to know everyone. This community is so big and so huge. Over we have over 200 beds. I believe we are exactly 257.
Yeah.
We can 257 residents. And just to plug in, we are doing a chicken soup for the soul family night on March 26th at 4:30. We've invited all of our resident family members here.
Mhm.
They're going to have a nice dinner with us and some inspirational reading. So that will be fun. We have
Nice.
a boots and bingo country western theme scheduled for next month. We're inviting the public. I believe it's April 20th. I'm not exactly sure on the date, but I believe it's April 20th. We'll have bales of hay and little country music and just some fun times with our residents and the community. So we are looking forward to that.
Okay, well, want to repeat the things that people can participate in. It's March 26th, the Chicken Soup for the Soul. That was a very popular series at 4:30. Do people have to sign up for that?
Oh, yeah, they can call and we'll take their information and they can come and join us and just enjoy our residents and enjoy some inspirational readings.
Okay, so that's for families and other people who may be interested in Harbor Place.
Yes,
And then the bingo country night, April 20th.
yes,
So that
at 6:30 p.m.
hey,
Boots and bingos. Come and wear your
boots and
Western.
That's a big deal. Bingo is a big deal.
Well, it all started because I bought these country boots, and I went to the activities director. I said, we got to do something for country, something, because I want to
Yeah.
read these boots, and I'm sure the residents will love it too. So we are just thrilled. We cannot wait. I especially cannot wait.
That sounds like a fun. I'm a big country lover, so I'm thinking that's a great theme. I'm thinking boot and scootin' bingo, right? I mean, what a fun, what a
They'll
fun event.
say, yeah, we're gonna have a party here. It's gonna be fun.
Yeah, awesome. That's wonderful.
I've been wondering for the families who are kind of struggling with nothing drastic has happened yet, but at what point do I call and ask and find out if my mom or dad needs help? What are the things that you hear from people?
The moment you feel like your loved one needs help is when you need to call. The
Yeah,
moment you feel it.
I totally agree with that, Candy. And I'm thinking if they're asking themselves that question, more than likely there's already a need. There's something that's causing them to ask that question.
Right.
And there's never been any kind of negative consequence for trying to plan ahead or at least gathering information. So, having somebody come out, whether it's somebody from Harbor Place or senior helpers, just to come out and have that conversation and learn a little bit more about what's going on. As professionals in the field, we kind of know what the trigger points are. We know the questions to ask that family members oftentimes don't. It's for family members, it's usually kind of a retrospective 2020, right? It's kind of like, oh, I should have known then
Right.
that we had a problem, but instead I kind of had my blinders on and, made excuses for it or what have you. And we waited a little bit too long probably. So if you're having to ask the question, I think go ahead and pull the trigger on having somebody come out and meet with you and have that conversation.
So you don't mind coming out and just talking for a while.
No, not one bit. Not one bit. Listen, my philosophy has always been, and I should back up and say, I before coming to senior helpers, my entire career was spent in the not-for-profit sector. So I kind of bring a not-for-profit mentality to a for-profit, organization and business. Yes, but it's all about outreach and education for me. And I know that many people will never use us. And, that's a blessing for them that they don't, perhaps they don't need to. Um, but I can't tell you how many people have called us 2, 3, 4 years down the road that said, we met you at so and so event or here or there, and we kept a card, or because you helped explain something or you helped provide this resource to us. Maybe we used an adult day center and we got by with that for 4 years, but now things are changing and we really do need home care. We want to come to you all because you helped make that connection for us, even though you didn't have to. I think it's just the golden rule, right? You try to put yourself in that situation. You try to use your empathy, and if you know the resources, say to families, yeah, you could do this, but maybe this is a better fit for you and your loved one. You're never going to go wrong. You're never going to go wrong making yourself available, providing information, and trying to connect people with resources. And if I just believe in karma. If they need you, they'll come back to you. And if they don't, that's fine too, right? That's part of our job as well. So,
But certainly, what you were both saying of know ahead of time before you're in the situation where you have to make a decision.
yes.
Yeah.
Yeah. Arm yourself with information and knowledge.
We have probably 3 minutes left. What would you like people to remember out of today?
Oh my goodness. Are you asking me?
Let's
Candy,
start
I
with
don't
you,
even.
and then we'll move to Kandi Tucker.
Um, I just want people to remember that I suppose if anything that we've talked about today resonates with you or your personal situation, or perhaps a friend or a loved one that that you understand that there are resources. And we actually live in a very resource rich community, if I'm being honest. Um, So we're here. We're ready. We're able here to help you. We have the professionalism. We have the knowledge. We have the experience. All it takes is a phone call, and there's no pressure. There's no commitment. It's just knowing that I can make one call and at least get pointed in the right direction, and that if I should need these services, I know there are organizations, not just Kandi, not just Harbor Place, not just Senior Helpers, but many, many great quality oriented organizations here that together can weave a safety net to support you and your family and help you through whatever situation you are or will be dealing with. And that's really the biggest takeaway. And that we do it with a full heart. That's why we're in this business.
I agree.
Okay.
Also, if you are finding yourself wondering about your loved one, whether it's your mother, your father, your grandfather, your aunt, your uncle, if you are wondering about, are they eating every day, or are they getting the proper nutrition, are they taking their medications, if you have any questions, you really need to pick up your phone and call someone, call home health, call Harbor Place. We're here to assist you. We can point you in the right direction. We can come out and do an assessment. Um, we we can give you the tools that you need to help make the proper decision for your loved one. And our number here is 772-337-4330. Again, our number is 772-337-4330. We are located at 3700 Southeast Jennings Road in Port St. Lucie.
And as I remember, you can give Harbor Place a call and come over and do a little tour.
Yes, exactly. We're ready for you. Come on in and let this place take your breath away.
Well, thank you. I want to thank Ron Radcliffe, Chief Operating Officer of Senior Helpers, for being a guest on the show today. And thank you, Kandi Tucker, Executive Director of Harbor Place, for hosting Never Alone, brought to you by Harbor Place. And we'll be back again next Tuesday. Thank you certainly for joining us.